Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about asthma. Asthma is an extremely common medical problem. Worldwide, there are some 300,000 folks who suffer from asthma. In this country, there are 25 million folks who suffer from asthma. Every day, 11 individuals in this country die because of asthma, and 4,000 folks every year die because of asthma in this country. Worldwide, there are 250,000 deaths because of asthma every year. And in this country, you have a situation whereby asthma is more common, well, not just in this country, across the world, asthma is more common in women than it is in men. But in particular, in this country, asthma is much more common in black, Hispanic, and other minorities than it is in white folks. And that's the reality. As a matter of fact, the death rates from asthma is 2.5% higher in blacks and Hispanics than it is in white folks. It is a very major medical problem. Every year, some 3 million folks makes visit to the emergency room because of asthma, and some 500,000 folks get hospitalized every year because of asthma. So this is a really serious medical problem. And what is asthma? As I explained last week, and I will explain again this week in case some of you may have missed last week's show. Asthma is really an inflammatory disease which is chronic. It used to be thought otherwise, but it is not. It is a chronic inflammatory pulmonary disease that affects the tubes inside the lungs. We call them the bronchioles. What happened there is that when you get exposed to an allergen, and the list of allergens, of course, is quite long, and I'll go over some of them with you. The individual inhale that, it gets from the nose down into the lungs, and there it causes an irritation because it is a foreign substance. The body reacts against it, and it causes an inflammation. That inflammation then causes secretions to develop. That secretion then causes the tubes that I just mentioned inside the lung to get clogged up. Because of that, the person cannot breathe. Now, the same thing that happens when you have seasonal allergies, you have runny nose and teary eyes and sneezing and coughing and that kind of stuff. There are a lot of secretions. Well, the same thing happens. In fact, most individuals who are asthmatic are also those people who have seasonal allergies as well. They are allergenic. They're more prone to develop allergies to different allergens than other folks. So once the inflammation develops inside the tubes of the lung, then the air cannot circulate properly. And the wheezing sound that you hear when somebody has an acute attack is because the air is fighting to get through the clogging of the tubes, and that causes the wheezing sound that you hear. Okay, so it's a very serious problem. And unfortunately, many folks who have asthma have been taught how to treat themselves. They have a lot of medications at home that are that are inhalers that dilate the smooth muscle inside those tubes to allow air to pass through, relieve the constriction. And there are several different types of this medication over in the market. Some of them are inhalers that we use. Advair is one of them. Albuterol is another, just to name a few. You will take a couple of puffs, and then that will open up the airway so that you could breathe better. Spiriva is another, etc. Asthma is another. I'm just thinking of them from the top of my head. There are tons of them out there. Fine. Epinephrine. Give somebody an injection of epinephrine under the skin. That also relaxes the smooth muscle, and these tubes allow air to go through much more easily. Unfortunately, some of these individuals have a habit of treating themselves too long when they have the acute symptom. They stay home too long. They're so used to self-treat themselves, sometimes they overdo it to the point where they wait so long, by the time they call for help, a significant portion of the time it's too late. They stop breathing. It is a well-known fact. You go to an asthmatic person who died at home, you see all these tubes and bottles all over the floor. They were just using to try to breathe. Instead of calling 911 or call a family member to rush them to the emergency room. And they're just so used to doing it for so many years. They've been doing it since childhood. And one time they do it a little, they waited too long. And sometimes these individuals just develop an infection in the upper airway like any one of us can. And that infection compromises the breathing apparatus in the lung, causing an acute asthma attack to develop. Now, I'm going to give you the list of some of the risk factors that can cause asthma. It's really quite long. You have genetic, of course, somebody, most asthmatic, if not all of them, inherited an abnormal gene that causes them to become asthmatic. If they live in the urban areas where there are a lot of pollution in the air because of all the cars, all the carbon dioxide that are being put out by the cars and the trucks and God knows what, the factories that are pumping out all this stuff in the air, and they inhale that. Um, Poverty is a big part of that. Poor education is a major risk factor. Indoor allergens, outdoor allergens, smoking, cigarettes or cigar. If you live in a house on an apartment that has a lot of roaches, mice, rats, moles, and old peeling paints, well, all these vermins, as they go through your room, and believe me, I know, don't I know? The first room that I rented when I just came to this country was in Harlem, but I think it was 212th Street, right next Amsterdam Avenue there. It was incredibly, it was terrible. The building in the basement and the first floor, that was a shooting galley for the drug addicts. And then upstairs on the fourth floor, I had to walk. The elevator was not working. I had to walk upstairs. There were so many roaches, so many mice and rats. I had to sleep at night with my toothbrush pinned to my pajama pocket. And then, of course, you know what happened to my toes and stuff. It was a disaster. So much so that my clothing, that were the few good-looking clothing that I had to go to church in those days, I was a very, very church-going Catholic. I mean, I wouldn't miss church for nothing. So I had to leave them at a friend's house on West 80th Street, and I would go there Sunday morning and get dressed. The place was so filthy, but that's what I could afford, what, $8 a week or whatever it was. So, and I go from one little kitchenette after other kitchenette throughout Manhattan, and I wind up in Brooklyn. You don't want to know. Yeah. In any event, enough of my past stories. So I'm talking about stuff that I experienced. So if you have a dogs, the dogs will shed stuff from its skin that will, you could inhale that. If you have a cat in the house, if you have birds in the house, those are all risk factors, okay? And I just mentioned the dampness, the poor humidity. You have to keep the windows closed, and then it is 90 degrees, and it is just brutal, okay? And you have to, and then of course stress. That's what I talk about, poverty. If you're poor, in particular if you live in America, people who are poor, who live in third world country, yes, they are poor, but believe it or not, they experience less stress than if they're living in an urban area. Because over there they have clean air to breathe, free space to move around, like I did when I was growing up in the peasantry in Haiti. I was walking barefooted, had no shoes, but I had clean air to breathe, and a whole host of other things that I had, fresh fruit to eat. You just pick up the mango, you just eat it. That kind of stuff. All kind of guava, all these things that I feasted on when I was growing up. So, yes, I was poor, but I didn't have the same stress that I experienced when I came to Harlem, my first spot, my first stop when I came to this country. It was brutal. Now, obesity is a risk factor because when one is obese, one's diaphragm is always squeezing. So obesity puts a tremendous amount of stress to the chest, causing air not to be able to be exchanged properly. So that's a major issue. Um, chronic sinusitis. People who have chronic infection in the nose of the sinuses, they constantly stop dripping down the throat into the trachea and wind up into the lung. That's a major problem. People who have GERD, gastroesophageal reflux disease, because the acid is coming back up from the upper esophagus, causing the irritation. So GERD causes cough, also can cause an asthma attack to to, to get triggered. All right, so GERD is a major problem, and of course GERD is very, very common. Um, I mentioned racial discrimination. Well, that is associated with stress. Anyone who has ever had the unfortunate experience of having to experience this racial discrimination is just one of the worst, disgusting experience any human being can have to deal with. And I know from personal experience, if you're getting inferior medical care, well, inferior medical care is part of the reason why the death rates in blacks and Latinos are 2.5% higher than it is in Caucasian, because these folks are less able to get quality care. They don't have insurance. They can't afford to pay for it. Even some of them who are working, they're not making enough to pay the bills and also pay for insurance. Okay, so that's a problem. You have some 50 million folks in this country without insurance. The Obamacare is helping tremendously. Those people who are against the Obamacare, they're not against the Obamacare, they're against Obama because he's a black president. They can't accept the fact that a black man has become president of the United States of America. And guess what? He was elected twice. Come on, it's reality. Face it. There's nothing you can do about it. So they're opposing Obamacare at all levels. They just went to the Supreme Court recently to chip away at it because they don't like the president for doing absolutely nothing wrong. He's just trying to do his job that he was elected to do. But they won't let him do it. They're angry. The anger is eating away at them. They want to undo that which God has done, which is an impossibility. Leave the man alone. Let him do his work. Let him do his job. The Obamacare is not perfect. I'm a physician, I know. But it's better than what we had before, when we had nothing before. So give it a chance. Let's see what happens. Many of us, myself included, would have preferred universal health care. I wrote a book. All these books you see over my shoulder, I wrote them. And I think 2 or 3 of them deal with disparity on health care. That's not what I would have preferred. But you take what you can get for now. That's much better than many, many presidents before President Obama have tried to get some sort of a health care for the poor. They failed. Now he has succeeded, and they try to chip away at it. Okay, now, what are the symptoms of asthma? Well, there are many. Coughing, wheezing, shortness of breath, tightness in the chest, rapid heart rate, sneezing, stuffy nose, runny nose, sore throat, headache, insomnia, difficulty in speaking. Those are dangerous stuff. Okay, now, those 2 books that you're looking at, these are the latest 2 books that I've written. Health Status of African American. I proudly wrote this book pretty much as a gift to the black community in this country and the world. I pour my soul into it. Chapter 32 in this book discussing asthma and black folks. That's correct. There are differences, yes. Asthma and black folks, the differences are many in white versus black. So take a look at it. You could find it at your local public library. I didn't write this to make money. I wrote it as a gift. What this country has done for me, the best I can do is try to help out. Help out, that's right. The best I know how. This other book called Ontology of Medical Diseases. It has 86 chapters. Chapter 69 discusses asthma and people across the world. This book is a tremendous book. It takes someone with years of experience, high credential, to be able to write an 86 chapter medical book from the top of my head, Anthology of Medical Diseases. Anthology stands for a collection of medical knowledge dealing with 86 chapters, covers medical care throughout the world. Take a look at it. You could find it in your local public libraries. Again, this is a gift to the world because of what this country has given to me. The best I can do is not to go out and make millions, but rather to teach, which is what I'm doing. 41 years of teaching, 20 books. These are my gift. I make enough to wear a nice suit and eat 3 meals a day, pay my rent and my mortgage. My kids have gone to school. That's good enough for me. I have no other ambition. All the jobs that have been offered to me, the answer is uniformly no. Let me take care of my poor patients. I'm happy doing that. Okay, so this is asthma. Now, I talk about symptom of asthma. There's a gadget. This gadget here I'm holding in my hand. This is the peak flow meter. Every asthmatic should know here's your peak flow expiratory rate. You must know what is your peak flow expiration is. And this gadget, this peak flow meter, I just borrowed this from the White Plain Hospital emergency room. It's brand new. Never used this before, but I used the old-fashioned one when I was in training the emergency room. This is the first time I'm seeing a peak flow meter in about, 41 years, something like that. What it is that you will breathe into these things, take it out, you'll breathe into it, and exhale as hard, as deep, take as deep a breath as you can, and push as hard as you can to push it out, push the air out. And then you move this gadget, you move this needle, and to know what is your best expiratory flow is. That's very important to know your best. Everybody wants to know what is the best they can do when they're symptom free. And you write that number down. And all asthmatics should have access to this so that they don't have to guess and spend so much time at home to be self-treating themselves. And if they know what the baseline peak flow is, when they try it again at home, they can't do it, then they know this is a crisis time. Call 911. My peak flow is abnormal, is very low. I can't move this. That means I can't breathe. I need help. I try to put the inhalers in to try to open the lungs to breathe better. I can't do it. After a while, the stuff doesn't work. Let's go. Let's call 911, take you to the emergency room. In the emergency room, we'll give you intravenous medication. We can give you medication that we have for you to use to inhale, a little machine that can open the lung quickly. We'll give you IV steroid. When you take steroid, it takes 6 hours for the steroid to take effect. So staying home, taking steroid, hoping acutely that can help you, it's not. When we give patients steroid at home to taper off, it was because they're recovering from an acute attack. We treated them with antibiotics and all these vasodilators, blah, 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 inhalers, and then we just now tell them to taper off. The steroid is a key component in the regimen that we use to treat asthma, because it is the singular medication that attacks the inflammation. It's an anti-inflammatory drug. Steroid does a lot of things, but without steroid, we can't save asthmatic. Steroid and penicillin are the two most used medications in this world, as we know it. Thousands of diseases are being treated with steroid. As I mentioned last week, and I'll mention it again, corticosteroid was synthesized by Dr. Percy Julian, a black biochemist who had to leave America to go to Europe to get his PhD because he was black and he was not allowed to get his PhD in this country. So he went back over there. Every one of us, myself included, who were using eye drops. These eye drops have steroids in them. They would not have worked were it not for this invention that Dr. Julian did. All of us who've had surgery to our eyes, as I have had, one of the key components to that treatment post-op is to put the steroid drop in there to decrease the inflammation, to prevent chronic scarring. All these things would have happened if Dr. Julian did not biosynthesize corticosteroid. He's a black man. And I can't say enough about him. Can't say enough. All rheumatological problems, no matter what they are, have to be treated with steroid. Everybody who have COPD and emphysema, everybody who have lupus, everybody who have rheumatoid arthritis, everybody who have sarcoidosis, everybody who has meningitis, infection in the brain, that the inflammation has to be decreased, needs steroid. Everybody who's being treated for lymphoma, leukemia of different types, they need steroid. Steroid is a fantastic medication to lyse the lymphocytes that cause lymphoma, leukemia. So we need steroids. That's exactly correct. The steroids actually lyse them. Everybody who have autoimmune disease of any kind needs steroid. Everybody who has autoimmune hemolytic anemia needs steroid to step in and prevent the antigen and the antibody reaction that's drilling the hole in the red cell. I mean, I can go on and talk about what steroid is doing and is able to do. And we don't give enough credit to black scientists, physicians, and others who have made major contributions, because it's not a good thing to talk about black folks on television unless you're talking about basketball, unless you're talking about football, unless you're talking about baseball, though we don't have that many black baseball players anymore. Most baseball players these days come out of college and white. It's fine. I love baseball. I watched baseball last night. Nothing wrong with it. But what culture is it that will only put somebody on television if they did something extraordinary the night before and they happen to be black? That's what they can do. How about talking about somebody who did something extraordinary intellectually who happens to be black? And there are thousands of such people around the place. Why can't they get some credit? How is it that it took 41 years and a group of students who I don't even know to have designated me as one of the foremost notable and outstanding physicians in the history of medicine in the world? The students did it. I don't even know them. This is not news. It is not new what I have been doing, what I am capable of doing. But politics, and racial politics in particular, have prevented my colleagues to come forth and say, this is Val. This is the guy who came up with the idea of circumcision to eliminate HIV/AIDS, to prevent HIV/AIDS, not eliminate, to prevent HIV/AIDS, that have helped at least 6 million folks, preventing them from getting the disease, that have prevented so many millions of women from getting cervical cancer, because once you remove the foreskin, you eliminate the sphagma that's under the skin that is irritant to the cervix of the woman. So as a byproduct of this circumcision to prevent HIV/AIDS, a lot of these women were found to have a marked decrease in cervical cancer and other sexually transmitted diseases that can be transmitted to the foreskin of the man's penis. This is not news. This has been going on since I did this article in 1986. And this whole thing, I called the New York Times one time, and I love the New York Times. I read it every Sunday, to let the guy know who I was. He told me he doesn't have time for me, that he's got 2.1 million folks that to worry about. You can't make this up, because in 2007, when Time magazine came out and gave 100% credit to this thing that I had done, and male circumcision to decrease HIV/AIDS as #1 against the top 10 medical whatever in the world in 2007, I wasn't feeling great. So I called the New York Times. I said, guys, come on. Can't you write something about this? I'm the guy. I'm still alive. This man picked up the phone. He told me he didn't have time for me. He has 2.1 million subscribers to worry about. And that's a liberal journal, mind you. A journal that I've been subscribing to, not, I mean, I buy it every Sunday. And that's a liberal. So if the liberal journal like the New York Times will even take the time to acknowledge my achievement, you would expect a conservative journalist to do it? Forget about it. So he took the students. Bravo to them that came out. Student, I know I was a student. Believe me, I did a whole lot of stuff when I was a student at Einstein that I couldn't possibly, they wouldn't even tolerate me to do some of the stuff, some of the stunt that I pulled when I was at Einstein and as a student leader to help open the door to allow Latinos and Latinas into the school. I'll crack you up if I were to let you know some of the stuff that I did, okay? But I was a student. I was tolerated as a student. They tolerated me. Now they wouldn't tolerate me to do some of this stuff, okay? In any event, I did promise, and I'm sorry I didn't keep my promise to talk about asthma only in this segment. I can't. I have to get these things out of my system because that's my only way of getting it out of my system. You know, they're not going to invite me on their television show. They think I'm arrogant and I'm too intelligent. I make them look bad, basically, because they get over when they can downgrade the minority person. They can't because my intellectual ability is such that what are they going to do? They can't. They can't match up with me. And if I'm on TV along with them, somehow they feel intimidated intellectually, not physically. I'm not a big man. So therefore, they don't want you to know I exist. This way they can keep going around pumping their chest how extraordinary they are. Okay? I don't believe so. I think there are a lot of extraordinary people in all races, in all sexes, or in all gender. That's my belief. Okay? In any event, this meter is very important. And all asthmatics should be armed with it, and they should use it twice per day and write the numbers down. And when the reading is bad, call 911, go to the ER. Listen, I'm stopping here. Until I see you again, this is Dr. Alcena saying so long and bye-bye.